Confusion in the health sector continues following the court's ruling declaring Social Health Insurance Fund Act, the Primary Healthcare Act 2023 and the Digital Health Act 2023 unconstitutional, and later granting the government 45 days to appeal the case. The Rural and Urban Private Hospitals Associations of Kenya now want Parliament to extend the transition period until the country is fully prepared. And as Emily Chebet reports, stakeholders in the health sector are accusing the government of rushing the process.
A ruling by a three-judge bench of the High Court suspending its decision to quash 3 health laws has only served to fuel deep-seated concerns among health stakeholders about the push to transition from the national health insurance without proper planning.
It's been too rushed. It's like we are trying to get to some finish line that we must get tomorrow. And you can see the effect of that, because once you start doing things in a rush, you end up with these constitutional problems that we have seen. Now, of course, it is confusing to us why the High Court would rule that the SHIF Act is unconstitutional and then still stay the ruling for 45 days.
The High Court declared the Social Health Insurance Act 2023, Primary Healthcare Act 2023 and Digital Health Act 2023, which replaced NHIF, unconstitutional. Justices Alfred Mabea, Robert Limo and Fred Mugambi gave Parliament 120 days to rectify the laws or face nullification. The court suspended its judgment for 45 days. Stakeholders want the government to ensure all laws are in place before rollout to avoid more problems in future.
The first amendment that Parliament must do within the next 120 days is to extend the transition. That is our view. In other words, get out of the box of we must do this within 3 months. Why? I mean, who says we must do that? We have very easy solutions. The current contract we had with NHIF, once you extended the transition, you can renew the contract on new terms.
The Ministry of Health has continued with a plan to engage Kenyans, calling on the public to continue with registration of the new medical scheme. Dr. Patrick Amoth led a team in Kapsowar, Elgeyo Marakwet County, even as private hospitals decried pending bills amounting to almost 29 billion from NHIF.
NHIF workers, because they don't know where they will go tomorrow, now they hardly do any work. You know, pre-authorizations are just pending. There's somebody in Kenya right now who wants surgery and has been waiting for a month. There's a kidney dialysis patient who's been waiting for dialysis. You can't miss dialysis. They have been waiting for pre-authorization for weeks.
Mbeleni, ulikuwa unaenda health center dispensary, kulikuwa na malipo kidogo. Hiyo sasa itakuwa ni gharama ya serikali kuu kuhakikisha ya kwamba hiyo pesa imewekwa, na wewe kitu yenye itahitajika kwako ni kujitokeza tu kujisajilisha na bima ya SHA.
The judges argued that the laws were passed hurriedly without proper public participation, among other shortcomings. Emily Chebet, Citizen TV.